everyone, this is Dr. Karl Yousef. I'm a board-certified emergency doctor. Today, I'm going to talk to you about one of the top, scariest cases that I've had in the emergency department. From babies not breathing to a man's face and mouth swelling so much that it would suffocate him, and even a man's scalp being ripped off of his head. These are real and very scary cases I've had that have made my heart pound in my chest.
My finger has a heartbeat.
I'll take you through exactly what happened and how I handled it. Some details are changed to protect patient identities. I saw a 55-year-old man who told me his lips and tongue felt swollen. He said he had never had this happen before. I looked inside his mouth and his tongue was definitely taking up way too much room. As an emergency doctor, we sometimes see these cases. It's called angioedema and it can be incredibly dangerous. It's actually a very scary type of case for us. This is because of his tongue and other areas of his mouth keep swelling.
It happens every time. They all become blueberries.
Soon, he wouldn't be able to breathe and would essentially suffocate to death. Turns out he was on a blood pressure medication, sometimes that is known to cause this. We gave him some of our own medications to try to improve the swelling, but I walked back in the room a couple minutes later and he told me it now felt like the back of his throat was swelling. He also couldn't speak anymore and his words were garbled because his tongue was getting in the way.
I feel like I ate a loaf of nuts.
That is a big red flag for me, and we immediately started setting up to put a tube down his throat and into his lungs before his airway closed up on us. I was definitely feeling my heart rate go up here because I really felt like we were fighting the clock, and to be honest, I didn't even know how much time we had left on the clock. It unfortunately got worse. We got everything set up to put the tube in. I let the nurses know we can give the sedating and paralyzing medications that we typically use. We had all of our backups ready and meds are pushed. 20 seconds pass, 30 seconds pass, 40 seconds pass. It feels like an eternity and he stops breathing. But that's supposed to happen. I take a look inside his mouth with a CMAC video blade to put in the tube, but the swelling has gotten so bad that I'm having trouble actually fitting the blade into his mouth.
It won't fit, Beavis.
We quickly pull out the blade, realizing the urgency of the situation, and we make sure to give him some oxygen. I switch the blade out for a smaller blade.
No, give me that. You have the little one.
But time is passing, so I quickly try again, and this time I can even see his vocal cords. But the swelling is getting so much worse. I try to put in the tube, but since his tongue is so swollen, the tube won't fit inside his mouth, especially with the CMAC blade right next to it. It was another 30 seconds, but probably felt like 20 minutes. His oxygen started going down, and we all started getting scared. We were worried that he would go into cardiac arrest. We started to get ready for what's called a cricothyroidotomy. This is a procedure where we cut into the cricoid cartilage of the neck and put a tube right through the neck so it can reach into the lungs to help oxygenate somebody. This is very rare and reserved for severe emergent situations. Luckily, an anesthesiologist happened to be walking by the emergency department and he walked into our room. I immediately had him make an attempt as I prepared to do a cricothyroidotomy. We always want to approach these cases as a team. Our patient's oxygen was dropping faster and faster. Luckily, the anesthesiologist was able to get a very small tube inside down to the lungs, but we hadn't won yet. We had to check the tube and we could hear lung sounds. We started aggressively oxygenating him and his oxygen saturation actually started to go up, and everyone in the room finally let out a huge breath of relief. What seemed like an hour of pure fear was actually about 7 minutes. As scary as that was, I can't get this next story out of my head. Click on the video link above to hear that story and subscribe so you don't miss out on any of these medical explanations.